My name is Mariano De Miguel. I'm a nephrologist. We see patients with kidney disease and hypertension. Today I'm going to talk about the myth of water consumption. Okay, what I see a lot of times, and I don't know how it ever got started, and this is something that not only is spread out in the in health books, but also it's also spread through health workers, nurses, medical students, and residents, and even doctors, pushing patients and forcing them to drink water. This is something that amazed me in the last 10 years, and I've been looking in the internet trying to see where did this come from, because in medical school there is no teaching that you are forced to drink 8 glasses of water 8 times a day. You know, this 8 ounces 8 times a day. It's a nice little simple rule. People love to talk about it. They want to do it, which is very difficult, but it has no, there's no basis. There's no basis to do this. Usually, there was a paper, 2012, in the American Journal of Physiology that clearly shows that even though thousands and thousands of people do not drink that amount of water, they're perfectly healthy. And it makes perfect sense, because we would not exist as a human race, or no life would exist, if we did not have a system that regulates your fluid intake. Mainly, it's your brain that senses the amount of sodium in your body, and then when you need it, it increases thirst, so you're tremendously thirsty. So that's one thing that I wanted to get through. You don't need to force yourself to drink water. The other myth is, well, it's true that you can drink tremendous amounts of water, but your kidney can excrete all that water up to a certain limit. And what is not true, that it's not, it has some risk. And if we all know, there are many reports of American athletes, triathlon or marathon, that are very well trained and that have died in the midst of a marathon. And this is because they have drank too much water and produced acute drop in their sodium levels, which is called hyponatremia. It's not from a heart attack or cardiovascular disease. What happens is that their serum sodium levels drop abruptly in the blood, and their brains get flooded with water. So they die from swelling of the brain. It's mostly neurologically. So it's during the process when you're running, you have all these types of hormones that kick in to help you hold on to water, okay? So it's not to say, for instance, that people that live in areas or are doing or working on a roof in the summer, well, of course, you have to drink extra amount of fluid, that's true, but the normal sedentary activity, we are not forced to drink 8 glasses of water. That's ridiculous. You drink when you feel thirsty. Your body will tell you. And this is another thing. The other myth is older people have to always remind themselves to drink water, which is not true. I mean, unless you're senile, and you don't think about, you have to be fed and everything, you drink the amount of water that you want to. I had this 90-year-old female that was living kind of independently, and they were just forcing her to drink water. Her serum sodium levels were dropping, and I just said, you just drink what you want to, and you'll be fine. So drinking plenty of water is good, but your body will control it. I mean, it's not going to increase your kidney health. Passing nice clear urine doesn't mean that your kidneys are healthier. It just means that you're getting rid of excessive water. So going to see your kidney doctor, you have a kidney problem, forcing yourself to drink more fluid is not going to be helpful. It possibly could be detrimental. Cut out all this water drinking already. You don't need it. Just drink what you want.